Many of you know I'm a huge fan of ProPublica. Their reporting has been cutting edge and tip of spear when it comes to so many important issues for us as Americans. I recently became aware of a year-long series called America's Mental Barrier. ProPublica basically followed and investigated the way that insurers have been kind of duping insureds. Have they been using certain practices that have interfered with insured's ability to be able to obtain the mental health treatment and care that they need? And in September of last year, they actually did a profile on a young man who his name was Ravi Coutinho. And this was in September of 2024, and Ravi's now dead. And his mother has now filed a lawsuit just a few weeks ago in Superior Court in Arizona. And I wanted to share with you Ravi's story because I think sadly and tragically, it tracks so much of what so many Americans are going through when it comes to mental health illness and the inability to obtain the treatment and care that they so desperately need and that they deserve, especially when you're dealing with a private health insurance provider. I mean, I can't think of a better situation. If you're getting private health insurance, you're paying every month premiums to be able to hedge against something happening. You're also paying those monthly premiums to be able to get the help that you need when you need it, not to have it punted down the road for months and for weeks. And we ask ourselves how things like, the murder of a CEO of a major healthcare company can happen, and we know why. Doesn't excuse the murder. Doesn't excuse it, let me be explicitly clear, but it explains why sometimes there's a perfect storm of conditions that are created through no fault. In this particular situation of Ravi Coutinho, through no fault of Ravi's own, but where it led to him ending up being dead. So I invite you to go and read this piece by ProPublica that came out in September, and I will give you the title of it in a minute, but I want to talk to you about Ravi, and I want to talk to you about who he was. Diagnosed with depression and anxiety, Ravi was 36 years old at the time that he died. He was a former college golfer, but he had become reliant on a very heavy form of self-medication, alcohol. And again, diagnosed with depression and anxiety. He had lost his marriage, and he was destroying his liver, and he was about to lose his job. He was an entrepreneur. He had a business. And he was drinking 1/5 of a gallon of liquor a day. That is the equivalent of nearly 17 shots. So at the time he was living in another state, he was treating with a therapist, and that therapist said, you know what, maybe you need to move back to Phoenix where you've grown up, your mom lives nearby, and maybe that would be really good for your mental health. It'll be better for you. So he moves to Phoenix, and he got insurance through a company called Ambetter. I know, the irony. Ambetter, Ambetter. Now, Ambetter, according to ProPublica's research, is the most popular option on healthcare.gov, the federal health insurance marketplace. It covers more than 2 million people across the United States. For $379 a month, he, as in Ravi, had a health insurance plan that, quote, appeared to have a robust network of providers. Appeared is doing a lot of work in that sentence. But let's stop. Ravi's paying $379 a month. That is not chump change. That is a lot of money. And he's paying it as a monthly premium to Ambetter to be able to get health care coverage. Ravi moving to Phoenix needs a therapist. He needs a psychiatrist. He needs a psychologist. He needs somebody to be able to help him manage his anxiety and his depression. So he went through the website trying to look and find a provider. He called one after another. He couldn't even find a primary care physician who could see him within 6 weeks. And he had a rapidly dwindling supply of antidepressants and anti-anxiety medication. Now, and I'm sure you've had this experience yourself, the providers listed in an insurance network have either retired or died. Many other providers have stopped accepting insurance because the companies have made it excessively difficult for them to do so. Some don't take new patients. Insurers are slow to remove these providers from directories. And this is so true here, right? It ends up adding up to a quote, bait and switch by insurance companies that leads consumers, consumers, to believe that there are more options for care than actually exist. Ambetter is a subsidiary of a parent company called Centene. Centene has faced its own investigations. It's been sued. It's one of the largest 25 corporations in the United States. It brings in more revenue than Disney, FedEx, or PepsiCo. But you don't really know the name Centene as the parent company because it has hundreds of subsidiaries underneath it, which includes Ambetter. It insures the largest number of marketplace customers, according to ProPublica, and it's the biggest player in Medicaid managed care and a giant in Medicare Advantage. Ravi, his mom Barbara, they tried to get help for Ravi. Despite more than 21 phone calls, Ravi was unable to secure a provider that would be able to help him for a variety of reasons, the details of which are clearly set forth in that ProPublica piece from last year in September of 2024. And the reason why it's so upsetting is Ravi, with the help of his mom, Barbara, who was kind of like a patient advocate, right? I mean, that's her only child. It's her son. And she's trying to get him help. And he and his mom are trying to get help for Ravi through his insurer, and they're hitting dead end after dead end after dead end. Despite 21 calls combined, adding up to more than 5 hours and 14 minutes, the insurer, Ambetter, did not line up a single therapy appointment. How frustrated would you be? And throughout the course of this time frame within which Ravi's trying to get help, doing what people tell you to do, right? If you are in a place that is so dark that you don't know what to do, people will say what? Go and get help. That's exactly what he tried to do. So, sadly, his mom tried to reach him in March, couldn't reach him, called Ravi's close friend to go and check on him. The friend entered the apartment and saw 4 empty vodka bottles strewn across the apartment. Now, mind you, it is so disturbing how much Ravi was spiraling and his descent was accelerating during this time when he was trying so desperately to find help. Ravi had a Murphy bed in his apartment. He also had the unconditional love of a dog to him that was his best friend. His friend hears the dog barking furiously behind the door. He knocks, he can't get in. He enters, he sees 4 empty vodka bottles strewn apart across the apartment. And he sees the Murphy bed is up against the wall, slightly ajar, but he doesn't see his friend Ravi. The dog is barking. And as he turns to leave, his friend says, and he looks at the Murphy bed a little bit more carefully, and he sees the lifeless foot of his friend Ravi wedged between the bed and the wall. Wedged between the mattress of the Murphy bed and the wall. I mean, I cried. I cried when I read that because I can't imagine how hard it was for everyone, but how especially and ultimately hard it was for Ravi that's what happened. So I'm sorry, in May of 2023 is when this happened. This was not just this past March. But Ravi's death was ruled an accident due to complications from excessive drinking, likely due to complications from excessive drinking. So his mom, Barbara, Ravi's mom, has now filed a lawsuit, an 83-page wrongful death lawsuit against Centene in Superior Court in Arizona. The lawsuit accuses the insurer Centene, along with its subsidiary Ambetter, that oversaw her son's plan, HealthNet of Arizona, of publishing a, quote, inaccurate and misleading provider directory. It accuses the companies of breaking state and federal laws, including ones that require the directories to actually be kept accurate. Centene currently has major cases in Illinois and California against it. Those cases are currently ongoing. And the lawsuit brought by Ravi's mom is premised on consumer fraud and false representations, which makes sense, right? This idea that you lure a person, a patient, to become an insured, and they are paying you to be able to get treatment or help in medical care. And you don't even have an updated directory of providers, let alone one that can provide the care that you are paying the premium for. I want to read a small portion of the lawsuit. It's the introduction, and it's worthwhile for you guys to hear. And this is directly from the lawsuit. This is a wrongful death and survival action wherein Ravi Coutinho died because he could not get the mental health services he was promised by his health insurance company. Ravi was one of many who have suffered at the hands of insurers engaging in the fraudulent and sometimes deadly scheme of creating ghost networks to attract unsuspecting potential customers by misrepresenting the care options available under their plans. Unbeknownst to Ravi and millions of Americans, these health insurance companies list many healthcare providers as in-network and available to plan members. Yet many of the providers listed either don't accept the health plan, aren't accepting new patients, have died or retired, or otherwise don't actually provide the services advertised by the insurers in their provider directories. The providers are, in effect, mere ghosts. Health insurance companies knowingly use ghost networks to not only lure in potential customers, but also to hide the fact that they are not actually providing sufficient and legally required services through their plans. The networks are both wildly inaccurate and grossly inadequate. Powerful, right? And yet true. And that's why I wanted to share Ravi's story with you, because I know, again, that his story is not limited to just him. It is not just limited to his struggles. And it ended in tragedy. And so we need to demand accountability from our insurers, but that also starts with making sure that our representatives in Congress know that they need to be making sure that the regulations and the regulators and that these things are being monitored and watched carefully. Once again, the judicial system has stepped in to be able to deliver justice, right? Barbara, Ravi's mom, is suing. Now, we don't know how the lawsuit's going to end up, right? But I think it's critical for us to always lift these stories, even though they are tragic and so sad. But we lift these stories up so that A, people know that others are going through a similar situation, and B, that people are fighting back. So again, I urge you not only to follow ProPublica because their investigations or stories are fantastic, but also I urge you to go and read America's Mental Barrier, the year-long series that ProPublica did. And wherein they focused on the profile of Ravi Coutinho so that you can see and read in detail what happened. And I invite you to share this video with other people. Let them know that I am watching these types of stories and these lawsuits on the Katie Phang News channel, and let them know that I am mad, I am outraged, and I am demanding accountability. So we need to make sure that we also look out for each other. I'll see you on the other side. Katie Phang here. The truth matters now more than ever. So hit that subscribe button so you don't miss a thing. Thanks for watching.